Hi everyone, I am Dr. Minal Mohit, Consultant Endocrinologist, Manipal Hospital, Jaipur. This event, RSSDI, the 50th anniversary, the 50 golden years of RSSDI, Research Society for the Study of Diabetes in India, is being organized at Chennai. And I am here a faculty and I am going to talk on a very important topic which discusses diabetes in the younger population, in the younger generation. As we have seen in the previous years, that diabetes is becoming more and more common in the young generation, in the adolescent age group, in the younger age group. And we all are worried about it because the younger onset of diabetes means a longer life to live with diabetes. As a result, a longer lifespan to live with complications. So, we are all trying very hard that we can reverse this trend of early onset of diabetes. To understand, we have to know why the younger population is getting affected with diabetes at an early age. Of course, type 1 diabetes, which was and still is the most common cause of diabetes in children and younger age group. But now what we are observing that it is not only type 1 diabetes, but it is the other varieties and other variants of diabetes which are affecting the young generation and young population. And the most common amongst them is type 2 diabetes. Type 2 diabetes, as we understand, is a diabetes of insulin resistance. That means there is insulin, but that insulin is not working properly. And the responsible factors are, of course, our changing lifestyle. Our younger generation is stick to the cameras, to the mobiles and to the screen times most of the time. So the sedentary lifestyle is one factor, and adding to that, our food styles and food habits and food tastes have changed. We are more towards the junk food. So the change in food habits along with the sedentary lifestyle is mainly responsible for the earlier onset of diabetes and the increasing prevalence of type 2 diabetes in the younger population. Now when a young man or a woman of say around 25-30 comes to us with high sugars, we are set with a differential diagnosis. We need to know whether it is type 1, whether it is LADA variant, whether it is MODI, or is it just a lifestyle reason being responsible and type 2 diabetes. To differentiate that, we need a detailed family history of the patient, because if it is MODI, that is maturity onset diabetes of the young, then there is a positive family history in at least 3 generations. So, not only the parents but also the grandparents of either side can be affected with diabetes. If it is a late onset autoimmune diabetes of the adult, that is the LADA, then it is going to be autoimmune positive. So, there are going to be antibodies present. So, if it is LADA, then the treatment remains insulin. If it is MODI, then again the treatment remains medicines or tablets. But if it is type 2 diabetes, which is most commonly affecting the younger population, then by reversing our lifestyle pattern, by inculcating a healthy dietary habits and a regular exercise plan in our daily routines, we can put our patients into remission, or we can even reverse the early onset type 2 diabetes in our younger population. Thank you.